food security is one very key aspect of civilization. And on that note, ladies and gentlemen, we bring you our very exciting keynote on addressing food, agriculture, malnutrition, and health together, an all-of-government proposal. On that note, ladies and gentlemen, it is my great pleasure to invite Professor Dr. Jomo Kwame Sundaram, Research Advisor, Khazanah Research Institute, to kindly take the stage.
Dignitaries, ladies and gentlemen, friends all. First, I'd like to thank the organizers for kindly inviting me to be with you, and I want to wish you Salam Alaikum. This old greeting, Arabic greeting, is something to be taken very, very seriously in our times. Unfortunately, we are living in very, very dangerous times where we have people who are quite willing to deploy high-tech weaponry, ostensibly for their own needs. This is a situation which we need to address, and I think it's important for us to recognize how difficult our challenges are. Allow me now to address you on what I hope may be a very simple innovation. A simple innovation which requires us to begin to think very seriously about the population which we have, and how an approach which might be useful especially for the Deputy Prime Minister as well as the Minister. We live in very troubled times, as I mentioned earlier, but we have a serious problem of malnutrition in this country. And that malnutrition begins with children. 1 in 3 students in schools are overweight or obese. 1 in 10 children are wasted, underweight for their height. 1 in 10 students are stunted. They're too short for their age. Now, if we think about it much more seriously, we will find that there are very, very many micronutrient deficiencies among Malaysian children. These micronutrient deficiencies are very, very serious, but unfortunately not well addressed either by the health system or by the education system. And so we find as a consequence that nutrient intakes, especially what are called micronutrients, as well as which include vitamins as well as minerals, are a serious problem in this country. It's not because this country is poor. It's because of various things which have affected our consumption habits. So it's important for us to begin to think about this and what can be done in relation to that. Now, many of you may not realize that about half of Malaysians are actually anemic. Anemia basically refers to lack of iron in their consumption, and it's important for us to recognize that the recent scientific evidence suggests that the distinction between nature and nurture, which we often make about people growing up and so on and so forth, is now so serious that nurture transforms nature. So as a consequence of that, anemic mothers, and women are more likely to be anemic than men because of the iron needs for menses. And as a consequence of that, we find that a great number of women are compromised. They are anemic. And this affects the ability to reproduce and also what happens in reproduction. So recent research suggests that the children of anemic mothers in turn have a number of deficiencies which compromise their ability to be mothers in a wholesome way in future. So we need to begin to think of this as an intergenerational problem, which is very poorly addressed because there's no money to be made in this. So the usual approach which many of us from the middle class adopt is to take vitamin supplements, to take mineral supplements, etc., etc. But this is often beyond the reach of most people in Malaysia, partly because they are not fully aware, but partly because of the circumstances in which they find themselves. So it's important for us to begin to address these questions. Then we have a problem of the fact that we are essentially a middle-income nation, where we, unlike my generation, for my generation, when we were growing up, some of you will remember this, you know, an obese child or a heavy child was considered sehat, budak tu sehat. You know, this is something you find in almost all cultures, in Malay culture, in Chinese culture, in Indian culture, and in my research in Sarawak many years ago, I found this to be true in Sarawak culture as well. Not that they wanted their children to be obese, and many of them didn't become obese because they played around and so on and so forth, but this was a very widespread and common condition. So we are now number 2 in Asia Pacific, number 2 to Brunei in terms of overweight and obesity among children. These are things which we shouldn't be proud of, and we need to address these problems in much more effective ways. Recently, a few months ago, an old school friend of mine, Dr. Khalid Kadir, passed away. He had started a campaign against diabetes in the early 1980s. And when I went to see him, many people knew that he was going to pass before long. I said to him, you know, Khalid, you started this campaign against diabetes in the 1980s. Before I could complete my comments, he interrupted me and he said, Jomo, I failed miserably. And why did he say that? He elaborated that when he was starting the campaign against diabetes, the proportion of Malaysians who were diabetic, and it's mainly type 1 diabetes, inherited diabetes, was about 8%. At the time we were speaking, the proportion had gone up by more than 3 times to about 26%. And the number is projected to go up to over 30%. And most of the people who are suffering from diabetes today are suffering from type 2 diabetes. When I was growing up, it was often said that Chinese didn't take sugar and they were less prone to diabetes because of that. Well, today, young Chinese children are taking a great deal of bubble tea and all these other innovations, which are commercially attractive, but basically are causing a huge number of problems. And these problems are transmitted to their younger siblings as well. And what we find in schools and so on is a huge problem. So what we need to do is to try to address some of these problems together. And I would like to put to you that there is an opportunity for the government to address 5 different issues. The question of child hunger and child safety can be overcome. The question of malnutrition. So to be fair, the question of child hunger is very rare in this country. Okay? There are people who are hungry, but they tend to be the exception. And they are often people we prefer not to look at. The children of, for example, illegal workers who are in this country. And it's not a small number. I still remember, I think it was Richard Riot, when he was Minister of Human Resources 10 years ago. He commissioned some of the CEOs of the telcos, and he asked them to estimate the number of foreigners who are working in this country. Some of you might remember this. And the estimate was 6.7 million foreigners who were working in this country. The official number of foreign workers at that time was, I think, slightly over 2 million, 2.2 if I'm not mistaken. So contrast the numbers, okay? Official figure, the estimate by the telcos was 6.7 minus 2.2, 2 million. So the result, 2.2, so the result is 4.5 undocumented workers in this country. 4.5. Consider that the total labor force at that time was 15 million. Okay? So when you consider so you add another 4.5 million, but all our statistics, official statistics, will pretend that they're not here. So the result is that our growth numbers look very good on a per capita basis. Our income numbers look much better on a per capita basis, but we are kidding ourselves. We have to recognize what the reality of Malaysia is. So we are often denying this. Now you look around you and you look at various sectors. There's almost no agriculture is dominated by foreign workers, most of whom are illegal. Construction is now increasingly legalized, but still dominated by foreign workers. And a whole range of even services. You go out and have some food in any small stall, and you will find that you're probably being served by foreign workers. So I think we have a situation where we are not really addressing the problems which we have in our country. And we also need, as I want to come to this quickly, we need to address the problem of malnutrition. Malnutrition is not just undernourishment. Undernourishment in the sense of not having enough macronutrients, such as carbohydrates and protein. Okay? We also need to think about the micronutrients. I mentioned vitamins, minerals, as well as trace elements. We need to think about those things very, very seriously. But our diet is becoming increasingly unfavorable towards getting our micronutrient needs through our ordinary diet. It is very difficult, for example, nowadays, if you're living in an urban area, to get ulam, fresh vegetables. It is a luxury to be able to get ulam. You have all kinds of other problems. You look at the preferred banana of choice. Professor Yasmin knows more about this than I do. The preferred banana of choice has a less of potassium and other nutrient contents. Okay, look at the batik, the papaya. The preferred papaya now is the skaki, 1 foot long papaya, because it's easier to pack. You can make more money by selling and exporting papaya. But to get your batik to be 1 kaki long, 1 foot long, you basically need to do a lot of modification, and all genetic modification can be problematic. Okay? So we need to begin to think about the nature of our innovation and some of the consequences. It's also important for us to recognize that often children, there are very important informal parts of the schooling experience which are important, which we tend to neglect. And we need to address some of these problems. And the last point I want to make is, how do we address the problem of the farmers who do not have enough incomes and and their well-being is compromised in important ways. We have thrown various kinds of subsidies with modest success. So I think we need to begin to think about how a very simple innovation involving what is called school feeding programs. It's not the only thing which we need to do, but it's one thing which I want to propose today, is we begin to have school feeding programs. Now, in many countries and cultures, you have different types of programs. But I would like to suggest that a school meal is something to think about. Now, the effects of school feeding on educational outcomes, particularly on the child's cognitive abilities, has been well demonstrated. It's also important, in other words, they can learn better and so on if they are properly fed. And it also enhances. We do not have a situation where you need to induce children to come to school, but we often find that children, especially from the poorest families, are keen to come to school. especially when there is access to a school feeding program. But it shouldn't be just for the poorest children. It should be for everybody, because there are important reasons why this is important. We find, for example, that many children do not feel ashamed, okay, to put up their hands and say, I want to be part of the school feeding program, because immediately it's a humiliating experience to undergo. When I was doing this research for this about almost a decade ago, around the time the first Pakatan Harapan government came in, at that time I was discussing it with a number of people, and we found, I asked various colleagues, and it's not a randomized survey, okay, but basically I found that a lot of people who basically didn't have adequate nutrition at home, but also didn't want to be stigmatized, socially stigmatized by signing up for the school feeding program. So the whole question of how you run the program makes a big difference in terms of how people feel, with a sense of belonging, their sense of purpose, and so on and so forth. So it's also, sorry, earlier I should also have mentioned that physically children grow up better. And I'm saying all this on the basis of research which has been done by the MOH. The Ministry of Health has actually got a division which actually works on research. But unfortunately, the MOH research findings, which have been the basis of a school feeding program in northern Johor. I was going to make a big deal of this because the Agong was supposed to be listening to some of this, but in northern Johor, this has been introduced basically around the Yongping area. But basically what we find in the MOH program is that children were also physically better off. Very few of them were actually obese, and so on. But what we find is that this program has not been adopted by many government schools. It is mainly adopted by SRJKs, Jenis Kebangsaan. So it is mainly Chinese medium schools, as well as very few Tamil schools are involved in this program. Because the catch is this, because Ministry of Health does not have money for this, they get their money from, the parents have to pay. So they have to pay 2 ringgit, okay? Consider this, this program, MOH program, runs on 2 ringgit per person. The current bantuan makanan for poor children runs on 3 ringgit per child, 3 ringgit per meal. And when the last government came in, there was a proposal from Tan Sri Zeti to increase it to 350. Okay, and 350, the additional 50 cents per day was multiply that by 5 days per week is going to come to 250. That additional 250 would go to 1 additional carton of sugar, of milk. Now, all the milk which is supplied through the school feeding program has added sugar. Okay, you cannot get real pure milk. They all have added sugar. Added sugar with your strawberry flavor or chocolate flavor. So you get variety. You get chocolate one day, strawberry another day. But what is the sugar for? It's completely unnecessary. In any case, there are much cheaper sources of calcium as well as protein than relying on cow's milk. In fact, many children in Malaysia are lactose intolerant. Okay, and this of course is a problem as well, because lactose intolerant children are not beneficiaries of this. When I was at the university, I think Professor Yasmin will remember this. There was a man named Professor Mukherjee, and Uncle Aziz, in his wisdom, decided to name the kambing he developed as kambing keji. Okay, so kambing keji ate oil palm waste, and that oil palm waste was was actually quite nutritious. You might not realize it. but because the parts of the plant basically are transmitting a lot of nutrients, plant nutrients, and plant nutrients, soil nutrients become part of the plant nutrients in turn become part of the human nutrients. So we need to begin to think about how this whole issue in an integrated fashion. So basically there are 4 key benefits of school feeding programs: education, health and nutrition, social protection, and as well as agriculture, the transformation of agriculture, which I'll come to in a minute. So basically, it would involve minimally, it would involve 3 ministries. Okay, Ministry of Education, Ministry of Health, and Ministry of Agriculture. But I would put it to you that because we have a proliferation of ministries and agencies in this country, it is important for us to begin to consider the role and contribution of various other organizations, all of which I've included in this picture. Now, let me quickly move to the governance of school feeding, and how it is important for us to have an interministerial cooperation. Now, as you all know, during the pandemic, one slogan became very important, 2 slogans became very important all over the world. One was an all-of-government approach. And the other element of it, which was very important, was an whole-of-society approach. We need to begin to think about this kind of innovation as involving not only all of government, which is the title of today's talk, but also how do you mobilize society. And this is very, very important. I'll just give you 1 or 2 illustrations later, but you can imagine that this kind of social transformation becomes extremely important. Now, let me move on very quickly to looking at the school level governance, and you can identify the various issues here. Now, currently, as I mentioned, food supplies here are largely controlled by one transnational corporation. As my Standard 1 classmate was the chairman of the transnational corporation, it will remain unmentioned, but I think you can all guess which one it is. And then you need to have monitoring of food preparation. And here I think this is one area where you mobilize parents. Parents will have an interest in their children's welfare, and so your PIBG and so on becomes quite important in terms of ensuring the hygiene, the safety, not only of the food supplies, but also of the preparation of the food. So now, in some areas, rural areas, it might not be worthwhile or economic to have separate kitchens for every school. It might be more worthwhile to have a central kitchen. So here is something where we can learn from how restaurants, for example, restaurant chains have innovated, and where we can learn from that kind of innovation. So this might be relevant, especially in relatively in rural areas. But at the same time, I think it is very important for us to recognize that in areas where it is too remote, it might not make sense to have separate kitchens. It might make more sense to have the kitchens to some extent in situ. So basically, what we also need to address is not only what is available through the school feeding program, but also what are the other areas, what else is available in terms of food. And we need to recognize that there are school canteens, and there's a great deal of food, which is basically what Malaysians would refer to as junk food. Okay, and this is usually sold. There are increasing controls, but not enough in terms of what is available in these things. So this is part of the reason why we have these high levels of obesity, etc., etc. So here I want to draw your attention to the Rancangan Makanan Tambahan, which is the government Ministry of Education program, and then next to that is the MOH program. Okay, and what we find is that the results from the MOH program, although cheaper, are actually producing better results, both in terms of the cognitive development of the children as well as the physical development of the children. So what we need to do is also address the problem of unhealthy foods and drinks. In fact, many of the drinks which are available are really quite unnecessary for drinking plain water is something which should be encouraged. But having plain water is not easy now. Go to most restaurants and you cannot get plain water. The only restaurants which still give you plain water for free are the Indian restaurants. Okay, others you pay for it. Okay, and this again is a bit of a problem. So we have changing food and drinking habits as a consequence of availability, among other, besides advertising and so on and so forth. So I just want to emphasize what I said earlier in terms of the better results of the HITS program of the MOH compared to RMT. But the HITS program is not perfect. Okay, and we need to begin to think about how this can be improved. And it only exists on a trial basis. Interestingly, not only in northern Johor, but also in various other places where usually principals have taken the initiative. So you have HITS program in Terengganu. You have a HITS program in several HITS programs in Perak and so on. But the vast majority have been in northern Johor for the reasons I mentioned earlier. So basically what we need also to complement all this, of course, is much better nutrition education. Not nutrition education in a formal way, but very informal nutrition education, especially for children as well as for adults who are going to influence these decisions. Now, and then, of course, having a supportive, healthy food environment. Now, I mentioned earlier that the school program is between 180 and 3 ringgit. There are a few schools in Johor which have pushed down the cost they charge children to 180. But generally speaking, they charge on a monthly basis. So you pay basically 40 ringgit for the whole month. Now, what happens is that, particularly for poorest children, their parents cannot afford to pay 40 ringgit. So the consequence of this is that the HITS program results in poor children either opting out because they cannot afford it, and when they can afford it, maybe 2 times a week, if they're lucky, they pay for the meal. So they pay basically a higher price, and it's usually it was in Johor, the average was 2 ringgit 50 cents. So you're paying 250. So the poor children are the ones who are penalized by this arrangement. So we need to begin to think of ways in which we can overcome some of these problems. I forgot to mention Negeri Sembilan, Kedah and Penang as well, besides Johor and Terengganu. Yeah. So here we see that the price range, okay, because its HITS is very much voluntary, left to the school, where there's no standardized subsidy, but all of them are below, except in the new states, they are under 3 ringgit, okay, or 3 ringgit is the maximum, and this of course is the price of the rancangan makanan tambahan which I mentioned earlier. Now, the implementation is very poor. There's very poor and very uneven. And although there are about 60 schools in 11 states, but we find that and there is some innovation in Sarawak and so on. But these are all really quite exceptional. Okay. Now, it is expanding, and this flag of Johor was there for the Agong. So, but basically, we are talking about a whole of society approach, because you need the PTAs involved and so on and so forth, for these things to succeed. And I'm speaking of this not simply out of out of thin air, because my boss in Brazil, when I was working in Rome, was Brazilian. And there he had led in Brazil a campaign called Fome Zero, which basically means zero hunger, abolishing, hunger in Brazil. Of which this school feeding program was a crucial part. Let me try to move a little bit faster because I'm running out of time. The impact of school nutrition program on children is very, very good. I've identified 5 here, but if you look at the literature, it is much more extensive. And I just want to draw your attention to something which I'll emphasize later, and that is that the introduction of this program is over a century ago, okay, in Japan, okay. So today, as you know, Japanese live longer than anybody else, and part of the reason, of course, is how Japanese eat, okay. So the benefits are actually very, very widespread. Okay, and we can see that over a century, this is still the case until today in Japan. Now, here are some pictures from a school lunch program in Japan, and you can see that every child in the school is involved. So a standard 3 child or a standard 4 child will help a standard 1 child. Basically tell him, wash your hands first before you eat, what utensils to take, and so on and so forth. And then the older children take on more responsibilities. So you develop a sense of community in the school, which is very, very important, I think, if we are going to make transform the character of the schooling experience to something which is much more, much better for people. Now, unfortunately, in Japan, this is the kind of waste you get. And we need to begin to think of ways in which we can reduce the amount of plastic in our lives. It is not with any pride that I read in the newspapers, and I'm sure many of you read, that Malaysia has one of the highest levels of consumption of microplastics in the world. Okay? And this can be traced back slightly over a decade ago. The Prime Minister at that time wanted to develop Malaysia as basically for plastic recycling. Almost 200 licenses were given for so-called plastic recycling. Unfortunately, more than 85% of that plastic cannot be recycled. So what happens? All that is dumped into landfills in Malaysia. So this is something which is actively happening. The licenses are still there. Over almost 200 companies are continuing to do this kind of thing, and we shut one eye because most of us don't live near landfills. We are quite unaware of it, but we need to begin to think about the consequences for our own consumption and so on. So I think it's very important for us to begin to recognize that we really need to innovate in very modest ways, but the way we live our lives makes the whole question of sustainability, which the Deputy Prime Minister emphasized earlier. What does it mean to try to achieve the Sustainable Development Goals? What do we mean? How can we innovate in ways which we can overcome some of these problems where we are, in a sense, poisoning ourselves? So the school feeding program benefits I've already belabored. I don't want to overdo it. And I want to emphasize how important this is. I also want to mention that the former Minister for Poverty in China gave me an award. I couldn't understand what he was saying when he gave me the award, but basically the award was he claims that I was the one who introduced the school feeding program. All I basically said, because for poverty eradication, after the Beijing Olympics, they got all these big residential areas, and they ran some programs. And all I said was basically to have, to bring children for breakfast to feed them. Apparently, they tried that, it didn't work. And what they did instead was to have a school meal program. So you basically expect that the children will come to school with a little bit in their stomach from home, and then they will stay in school until it's time to go home. Whereas the children if you gave them breakfast, many of the children in the poor areas were leaving the school after having breakfast and going home to help out their parents. So you need to adjust. You can't just mechanically do something like this. So this has worked in many countries in the world, even in India, which is again a much poorer country than us. You have many of these things. So I think we need to begin to recognize that there are many benefits to be had from innovating. I didn't talk very much about the agricultural benefits, but we really need to put much more emphasis on not only on having enough rice, which has been the traditional emphasis of agricultural policy, but have much more emphasis on producing what is nutritious and important. And in this regard, I think the production of much more vegetables becomes very important. And so we need to redirect our incentives away from rice to vegetables. Now, this year happens to be a year of a lot of rain because of La Nina and so on and so forth. But we also know that before the pandemic, in the 5 years before the pandemic, 2 planting seasons had to be cancelled in Muda. There was just not enough water. Okay, so we need to begin to think about how do we overcome these problems. If we switch to vegetable farming, for example, would we be able to better serve the interests of our population and also of the farmers involved? So we need to begin to think about these problems. Innovation has to come out of a deep understanding of the context in which we are working and the kinds of innovations we should best address those issues in the best interest of the people. Thank you very much for your attention. Assalamu alaikum.